Hi everyone, it's Linda Esposito from Be Clear with Bronchiectasis. Today we're going to talk about sterilizing. We've talked about it before, but there seems to be a lot of questions about sterilizing our airway clearance devices. So I'm going to weigh in, give you some of my thoughts on it, and of course, always speak to your medical team. I am an educator, I am not a clinician. So let's get started. Oh, and please like this video and subscribe to my YouTube channel. There are over 60 videos, and I make them hoping that they're going to help you in some way just to better understand the disease and what needs to happen as far as taking care of ourselves. But remember, we're all different, and what might work for one person might not necessarily work for another. And that's particularly true for sterilizing. It's actually true for a lot of things, including airway clearance, but today we're talking about sterilizing. There was a little bit of misunderstanding because I talked about a UV sterilizer that I have, which is not this device. This device is a steam sterilizer, baby bottle steam sterilizer. And the difference is this one, you put water in it. You actually put 150 milliliters. So you put a lot of water, especially compared to the others I tried. I tried the Wabi, and I tried the Avent from Philips. And this one takes the most water. And so why did I like that? If the more water it takes, the longer the sterilizing is what I found. So the sterilizing cycle on this device is just about 15 minutes. Sure, it takes a minute or so for the water to heat up, but for those of us who boil, we know we boil for 10 minutes, and I just liked knowing with the steam there was even a little bit extra. So I went with this one. As I said, it goes a little bit longer, and then there's also the dry. Make sure if you do get a baby bottle sterilizer, be sure to get one with a dry cycle, because sometimes we're like focusing so much on the sterilizing, whether it's boiling or whether it's using steam in a device like this one, or perhaps a microwave. And then we forget, or we don't seem to be as concerned about the drying. And I am. One of the reasons I like this device so much is because I can get my devices bone dry. I mean, I run it, it goes for an hour. And so there's 15 minutes of sterilizing and then 45 minutes of drying. But I usually run it through one more time before I take the pieces out and put them in a drawer. And I have a new practice, and I jokingly say, even though it's not funny, that the great thing about a chronic illness is that you always have an opportunity to improve your systems or put new procedures in place. But one thing I've been doing is I have been just putting the pieces in my drawer. I don't put the devices together anymore, just in case there's a little moisture. I have multiple devices. I won't be using it and taking it out of the drawer for a while. I just want to make sure everything stays as dry as can be. But that is why, another reason I like this particular device. And it does hold a lot. As you can see, it's a big thing. It's, I guess, bigger than a bread box, as they used to say. But let me just show you what this particular one is like. Now, I am not in any way promoting the Bololo over another one. From what I've read, there's been like, I don't know, I've read about 5 pieces of research on baby bottle sterilizers, all different types of sterilizers, different manufacturers, I should say, and they all get the job done. Most recently, Dr. Jennifer Honda, who had a lab at National Jewish Health in Denver, one of the top lung hospitals in the United States. She presented research at a patient conference that showed a baby bottle sterilizer was able to kill 80 different types of pathogens. And that included, or bacteria, mainly bacteria, I believe. that included gram-positive, gram-negative. So it also included mycobacteria, which is something many of us are concerned about. I personally had MAC for over 2.5 years, which is Mycobacteria avium complex. I had an infection from it. I was able to clear it, but I certainly don't want to get it again. So I do try to use the highest level of sterilization. And I also know that Dr. Daly and Dr. Casper Bauer from National Jewish have also, and Dr. Pamela McShane from UT Tyler have recommended baby bottle sterilizers. So if you have one already, don't go running out to buy this one because it's probably getting the job done. But if for some reason it breaks down, just keep in mind this one takes the most water from the 3 that I tried. And the sterilizing is the longest. Okay, so what do I do and how do I do it? Well, let me just show you this device in 3 parts. Now, I deliberately left the base so that it has mineral scale on it, because that can happen very quickly. It really happens like the first couple of uses if you're not using distilled water. So distilled water is not sterile water, because although the distillation process, you would think that it becomes sterile, but the equipment isn't sterile, from what I understand from our favorite microbiologist, Dr. Joseph Falkenham. So he says distilled water is not sterile, but it does prevent this, okay, the scale buildup, the minerals. I choose not to use, I don't use distilled water, because what I do is once a week, I take all my equipment. See, this is my dirty bin. So as you can see, I need to do some sterilizing. So I hear all my Airway Clearance, my Aerobicas, my nebulizing cups. I even have tongue scrapers in here, and I have lots of toothbrushes. This is just from this week. So I take that container and I fill it with dish soap and warm water, and I agitate the water. And you know what? Often I do that the night before. And then I get up in the morning and I agitate the water again. And so this water has been well agitated. And then I rinse it. And I started to say the reason I don't use distilled water is because I do this once a week. And so I don't want to open this container of distilled water and just have it sitting there for the next week. I don't think that would be the best practice. So I just use tap water in my sterilizer. And when I put as I said, I soak them up, I agitate, I rinse them off. I rinse them really well. And then I shake them all out, trying to get every last drop out before I put them in this container. And I usually do like 2 or 3 batches. I don't really pile them up, although there was research done by the laboratory director at Yale New Haven Hospital. This was about more than 10 years ago. And he piled them up because he figured that's what people do. They're just going to throw them in and pile them up. And everything came out, with no bacteria. So, but I don't really do that. I kind of lay them out, no special way. But of course, first I put in the water, because that's what's going to create the steam. And then I put the devices in this tub. And then there's another shelf. And I put this on top. And I put like the toothbrushes, and I put the mouthpieces up here, but really they could go in the bottom as well. And then I cover it and set the time, and then it goes on, I put on automatic for 60 minutes. And like I said, I usually hit the dry cycle another time. I then take everything out and throw it in a drawer. But let's say you have one device. That's all you have, that's all you want. You use it during the day once or twice, and then you put it in your soapy water, maybe while you're making your dinner. You agitate the water, it's soaking, and then afterwards you rinse it off well, and you stick it in the baby bottle sterilizer. This baby bottle sterilizer many people choose to just leave their devices in their baby bottle sterilizer because it will come on periodically and just keep everything dry. So not the steam function, but rather the dry function will come on periodically to keep everything dry. So the other question that comes up is whether or not I use sterile water. Sterile water. And the answer is sometimes. So sometimes I just use tap water, I put it in, because really, if you take the top off and just look at the plate, it's boiling within a minute. So I feel very confident, but I often leave my SteriPen, which is a UV sterilizing pen, in the bathroom. So while I'm getting set up, I have a cup of water, I put the pen in, I lean it against the counter, and so for 90 seconds, it sterilizes the water. Sometimes I do it, honestly, and sometimes I don't. It's not necessary. It's like double knotting your sneakers or something. It's just an extra step, but it isn't necessary. And there is another question. There was an issue with this particular baby bottle sterilizer that it has filters, and we could not get replacement filters. They were out of them, and they really weren't very forthcoming about when they would be available, which we did not like. So why am I having trouble now? Every time I always have technical problems. But I'm just showing you there is a filter here that usually can very easily be changed. Honestly, I've checked, it says change every 3 months. I've checked this filter repeatedly, and it's as clean as could be. So I have not changed mine, and I've had it for quite some time. That's your decision if you want to change it every 3 months. One thing I did do, because there was an issue in getting the filters, is I stockpiled them. So you might want to do the same. I bought this through Amazon. They had the filters were available, weren't available. I actually ended up getting the filters after they weren't available for a period of time directly from Bololo, but then they did become available on Amazon as well. So I feel very comfortable with it. I don't have room. If someone, I live in a 1-bedroom apartment, so there is no room to leave this out anywhere. So I put it away in the closet and then pull it out once a week. And that's why I have multiple devices and have this approach of batch cleaning. But certainly, as we discussed, they can be cleaned every night, just popping it in. And I think that's what Dr. McShane said. You know, just at the end of the day, pop it in your baby bottle sterilizer. So I also have a UV sterilizer that I did another video on. It is as big as a bread box. And I have it because I used to boil all the time. That's what I did for the first couple of years, is boil my devices for at least 10 minutes, shake them out, and then they say just air dry them, but sometimes I found that they weren't dry. And so the way I improved that procedure was to buy this UV, so it's dry, there's no moisture. In fact, I have it in a closet by my printer. Every little bit of this apartment is interior real estate is taken. And then I would dry my devices. And you know what? Since it was a sterilizer, I turned on the sterilizing cycle as well. So I would sterilize them after boiling them, sterilizing, and dry them, and then use them after that. So now that I have the Bololo, it's not really necessary to, I don't boil anymore, and so it's not necessary to dry in the UV sterilizer. So what I do is I have little water bottles that I take to the gym that they fit in there just beautifully. I have lots and lots of toothbrushes. I mean, I have a half a dozen because I use my toothbrush maybe 1 or 2 days. And then I just pop it in my dirty bin and I clean it along with my nebulizing and airway clearance equipment. That's what I choose to do. But it might seem extreme, but it's really very easy. And some people are talking about just using a little dish soap and cleaning their toothbrush. Other people want to put it in hydrogen peroxide, or they put it in mouthwash. Whatever you do, I think you should do something, because it's not really talked about. I've never had a doctor bring it up. And I did ask a doctor, and his answer was, well, Linda, there aren't many NTM in your mouth, so you don't really have to worry about cleaning your toothbrush. Well, we cough and we spit stuff up, and that goes into our mouth. So I want to make sure that there isn't any bad dudes hanging out of my toothbrush. Also, there was research done. It was for a community of children with cystic fibrosis, and many of them were getting Pseudomonas, and there was some research done where they went into their homes and cultured their toilet and also the toothbrush, and they found out that the same isolate of Pseudomonas was in both. So I choose to take precautions with my toothbrushes. I certainly keep the toothbrushes away from the toilet. They used to be very close to the toilet. I admit it. I just didn't think, sometimes you just don't see what's right in front of you. But now I put my toothbrush away in the closet, or I have this little Brill UV sterilizing top that's just for the toothbrush. But I'm just using it a couple of days, even though they say you can use it for 3 months. I just have my own little approach, which is easy because of the baby bottle sterilizer. But often, if I'm not ready to batch and I, for some reason, don't have a clean toothbrush, I'll use a little soap, clean off the toothbrush, and pop it into my UV sterilizer. So that's like my backup plan. I also put I have a mouth guard that I wear at night, and I sterilize it with a particular tablet that is just for retainers. I think it's called Retainer Bright. And then I dry it with a paper towel and put it in my UV sterilizer. I do not put the heat on, because you do not want to melt that device, because I've done it and it was an expensive mistake. So I hope I have clarified some of this, what you choose to do, whether you want to keep on boiling because that's your thing and it works. And I say, if it's not broken, don't fix it. If you want to keep on boiling, or if you want to use the UV sterilizer, or perhaps you want to use a microwave baby bottle bag they're popular, do what works for you. And I liken it to cooking. Sometimes we're cooking on top of the stove. Other times we're using the oven. Sometimes we're popping something into a microwave, and sometimes into the air fryer. And that's the way it can be for us as well. We might decide, what I do is, for the most part, I'm using just my baby bottle sterilizer when I'm home in New York. If I go to my daughter's house and I'm going to stay there overnight, and if I don't bring 2 sets, I might bring a baby bottle sterilizing bag with me for the microwave. Or certainly if we're on a road trip, I might do that. When I went to Italy last year, I brought something along that's called a drizzle pot. So, and then when we go to California in the wintertime, I don't have a baby bottle sterilizer, and I'm not bringing it with me. But years ago, I did have another UV sterilizer because I was just boiling. And that's what I still do when I go out to the desert, is I have a pot and I boil, and then I put everything in a UV sterilizer that I leave at my friend's house in the desert. She stores it for me. So a little bit of this, a little bit of that. One person might do one thing, you might choose to do another. And then, you know what? There are some real reasons why someone might not want to boil. And that could be if you're older. I have some older clients, and they themselves say they're forgetful, or they have neuropathy. They're just not that steady on their feet, and they don't want to be dealing with a pot of boiling water every day. Or if you have small children underfoot, or even pets underfoot, you might not want to do that. Or if you're working from home and easily distracted, or you go, you get an email or some bell goes off and you walk away. And I've heard quite a few stories of people doing that. Nothing serious, thank goodness, but they've walked away from their pot on the stove. But for others, it's something they're very comfortable doing it. They have their routine. So remember, it's just about figuring out what works for each and every one of us at this point in time. Okay, everyone, I hope this has been helpful. Take care. Bye-bye.